Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have a very special guest with me. I have with me Dr. Toya Lucas Sampson, Dr. Toya for short. And we are going to be talking all about running in the postpartum period. So, Dr. Toya, welcome to the show.
Thank you. Thank you so much for having me.
Yeah,
Yes.
my pleasure. Can you tell us a little bit about yourself and then we'll kind of get into it from there?
Yes. So I am Dr. Toya. I am a board certified OBGYN. I'm originally from Trinidad and Tobago, which is in the Caribbean. And I currently live in California with my family. And I am the founder of Amina OBGYN Consultants. It is now a virtual GYN practice, special focus on the postpartum period. So I'm very excited to talk about this, particularly the extended postpartum, that 3 to 12-month mark, supporting women through that in a holistic way, because I feel like it's kind of like a forgotten area.
Yeah. This is like the fourth trimester, yeah? Ish?
Well, no,
No.
I'm
Oh,
glad you
go ahead.
said that.
Let's start with that.
Yes. So the fourth trimester is actually from birth or from delivery until 3 months, so that 12-week mark. And the reason I changed from saying birth is because that's one of my, like, get on my soapbox. Everybody categorizes everything in the postpartum up, like, from the baby's perspective, right? So it's from when the baby was born until the baby is a year, or when the baby is born until the baby is 12 weeks. And I know you're a pediatrician, so you probably do that as well, right?
Yeah.
But I'm an obstetrician and I care about mom. So my whole thing about supporting women through this time is really changing kind of the narrative and making sure that we prioritize ourselves as moms. And you have to be okay for your family to be okay, especially from the mental health aspect. So I just got on my soapbox there, and I'll get off and actually answer your question. So the 4 trimesters, the first 3 months, and then the actual postpartum period in general is from delivery until 12 months.
Okay. I love that. No, that's true. And I know, I guess I am a little bit selfish looking at it from the baby's perspective,
Yeah.
doing what I
I think
do.
everybody is. That's how society is. So it's not just you. And you're a pediatrician, so it makes sense.
Yeah, but over here at Mindful Marathon, we're very into self-care and you can't be able to run all these races and do all of these things if you're not taking care of yourself first. So we're on the same page this
Yes.
way.
Yes.
I mean, I get a lot of questions from runners about this time period and in terms of like what is safe to return to run and things like that. And most people aren't asking me the day after they deliver their baby if they have a marathon on their list. It's much later. But can
Right.
you speak a little bit about like that fourth trimester and then maybe when it may be safe to do physical activity in general and maybe get back to running?
Yes. So there are things you can do from the time you have the baby. And I think people just assume, you have to wait to get, cleared by one of us before you start doing anything. And while that is true, you just want to make sure you don't cause more harm than good. Just being mindful of how you move your body, especially when you're picking up the baby, can be helpful. So the breath work, like doing belly breaths that everybody knows about, right? So expanding your abdomen, lengthening the pelvic floor, and then when you breathe in, everything contracts. Doing those kinds of breaths really help you prepare for the types of exercises that you're going to do later on. And that's whether or not you have a separation, right? So just doing that from the beginning, getting in that rhythm, and then being mindful of engaging your pelvic floor when you're doing things like picking up the baby and, bending and stuff like that. So that if you have any issues, like leaking or separation, you're already training your core to be strong.
Mm-hmm.
And then when you start doing exercises, you already have that kind of muscle memory of the movements that you're doing. So really before 6 weeks, that's all you're doing is the kind of breathing and the engaging of the pelvic floor and then giving your body time to heal. A lot of the postpartum is just time.
Yeah.
And then once you get to that 6 week mark, barring any complications like excessive tearing or anything like that, then you can start physical activity. And I always say gradual, like listen to your body and go with the way that your body is telling you, listen to it. Pain is there for a reason. So I can go on and on, but
yeah, no, well, I think just a reflection, it's sort of the same advice for people who have had injuries or have just taken a long period of time off of running. And it's sort of like, think about however long you took off, it may take that amount of time to really like get back into it in a very gentle, easy way. So I know we want results like yesterday. We are high achievers. We have a lot on our to-do list. And so sometimes like having patience with oneself is the hardest thing.
It is. Yeah. And, when you start, I think I really like the exercises that we do for separation. So that diastasis recti or diastasis, however you want to say it. I think it's a good start for anybody, even if you don't have a separation, because I think a lot of people want to just start doing, these intense exercises, and you really want to make sure you're strengthening your core first and then doing other things like starting to run and things like that, because you don't want to cause more damage. And then you also want to prevent issues like leaking and prolapse and things like that. So I think starting that slow, because those exercises, I don't know if you've ever done them, but sometimes it feels like nothing's happening, but something's happening.
Do you have recommendations of where people can go to find those, or should they ask their OB, or is this like, is there a website we could go to just do them?
So the thing about it, there are a lot of them.
Okay.
And it's one of those things where I hate to say to Google, because you never know who you'll get. But I will tell you what my pelvic floor physical therapist told me, which I'm going to get into in a second, is one called the Bloom method. Because I hesitate to tell people just find somebody, because you never know what they're telling you. A lot of people say a lot of crazy things on the internet, but the Bloom method is one that's on YouTube. That's good to really focus on the right types of muscles and the right types of exercises. And if you have the ability to see a pelvic floor physical therapist, that's really like the best place to start, because they are going to give you like a full assessment and give you directed exercises. And that's what I had to do, because I had a lot of issues like with pain and stuff like that postpartum.
When could someone see a pelvic floor PT? Like, is that after the 6 week mark would be a good?
Usually. And, it depends on so many things, because there's a little bit of a barrier of to access. Yeah, because they're not a lot of them. And then if they're out of network, if they have availability, all of those things. So you can want to get in, but there may be that little bit of barrier. But yeah, usually after. And then if you're having actual issues, so like I was having pain, it was a little bit more of a priority for me to get in, because I had some pelvic floor dysfunction and like some SI joints. There was a lot going on. So like if you're having like an actual issue, it's like a priority, and your OB can help you navigate that system to get in to see someone.
Okay. I think maybe we can stay in the pelvic floor. I feel like that is those are common issues that runners have in that postpartum time period that they may not have had prior to having a baby. And so running things that we may not have given a second thought to, but now we're out there and we have to pee every 10 seconds. We feel like we need a bathroom on every sidewalk corner. So
Yeah.
maybe could you speak a little bit about that? And it sounds like we're saying pelvic floor PT is maybe the best way to go,
Yes.
but
It
maybe.
is. Yes. And I think starting with your gynecologist also helps because they will be able to assess and make sure they're not like different things going on. Because I think people assume that the leaking and having to run to the bathroom is all one thing, but they're actually separate things.
Mhm.
So there's the urge and the stress, without getting too technical, right?
Yeah.
And they're treated different ways. So you really need a combination of your gynecologist and your pelvic floor physical therapist to work together to make sure you're getting everything treated. So, I'm all about the holistic treatment, right? And making sure you get those things evaluated properly and then treated and doing the exercises. I tell you, I did not do my exercises. It is very hard to actually do them. So being consistent. So don't do what I did. Be consistent. But it can be pretty difficult to keep up with all of it.
Yeah. Yeah. I think that's really the same way with physical therapy after an injury too. It's the accountability of
Yes.
seeing the physical therapist, once a week or twice a week or whatever it
Right.
is, but it's accountability for me to do the exercises if I'm going.
Exactly.
But then when I'm
Yeah.
going, going down to once a week or once every other week, it's like really taking on the
Yeah.
ownership of doing the
Exactly.
exercises. But maybe it's important then to just to keep in mind your end goal, whatever
Exactly.
that may be. So that,
Yeah. And if you're trying to get on a run and you're leaking, then it may be like, the reminder, hey, did I do my exercises today? So yeah, so it's definitely important, but I'm not gonna get on a high horse and be like, do your physical therapy, because I know it's difficult.
yeah,
So let's
yeah,
all do the best we can.
that's right. That's all anybody can ask. Would you maybe be able to speak about this is maybe like taking a little shift into mindset
Mhm.
in terms of like maybe someone was an avid runner before they had their child, and now they're finding challenges in
Mhm.
terms of like the schedule and also fatigue and
Mhm.
all of those things that come with being a new parent.
Yeah.
And a lot of my runners, they don't give themselves enough credit, but they're very hard on themselves
Yeah.
because they are not able to, train for that marathon the way
Mhm.
they thought they would be able to. They may have to downgrade to a different distance or push it off for another year. And that makes
Right.
them feel all sorts of ways, but maybe we can take it in that direction.
Yeah. So I'm so glad you brought that up because that's part of, how I support people through this time is the importance because there's so many different layers. So your running is your form of self-care. It's also the time that you take for yourself, something that is important to you. So making it a priority. So your life will change. Like, those cheesy commercials, a baby changes everything, right? It's true. Babies change everything. But making sure that you set firm boundaries to say, okay, maybe I can't do everything. Maybe I can't do the whole marathon, but this is my time to run because it is what I need to do to make sure that I'm okay. I'm going to make this happen regardless, right?
Yeah.
And then I think the biggest thing is giving yourself grace. Like we have a lot going on in our lives, a lot to care for. So you may not necessarily be able to get there now, but it may happen in the future. And once you're intentional about giving yourself that time and being consistent, you will get there. Just may take you a little bit longer. So not thinking of it as a luxury, like going on this run is just something that I can do, but it's not a priority. It's the priority, right? You are the priority. And if running is your goal, getting there is your goal, then making your life not revolve around that, but structuring your
Structure
life
it. Yes.
so that you can make that happen so that, you are a whole person that needs to be okay before you can take care of the family.
Yeah, yeah. I mean, everything you say is music to my ears over here.
Yeah.
I'm always, if you've been a long time listener,
Yeah.
like I love that, something is better than nothing. And
Yes.
everyone has periods of time where we need to take a pause from running for whatever
Yeah.
reason. But I know that is easier said than done
Mhm.
for me too.
Yeah.
It's just hard. It's hard to hit pause. It's hard to see maybe where you were and where you might want to get back to, and
Yeah.
have all of these goals on the calendar. But it's okay if it takes a little longer to get there.
Yes. Yes. The pace of grace that's what they say, right?
Yeah,
Yes.
yeah, for sure.
Mhm.
Well, is there anything else that we didn't touch on that we should?
I just want to go back and, reiterate the point that a lot of issues you may have in this postpartum period, a lot of them are going to be resolved with time. And I'll give a little bit of my story. I had the dysfunction in my hips and my pelvic floor after I had the baby. And because of my access as an OBGYN, I was able to get in really quickly. And, she gave me all these exercises and I did them sometimes. And then, with time, I think I spoke to her when I was about 7 months postpartum, and she was going through things with me, and she said, so do you think it was the exercises that helped? Because I was a lot better. She's like, is it the exercises or was it time? And she kind of just went quiet, and I was like, yeah, I think it was time. She's like, okay, good. Like, she was waiting for me to get there.
Yeah,
And this was my pelvic floor physical therapist. So yes, people have like issues that need treatments and stuff like that, but a lot of the issues you have postpartum will get better just the further away from the pregnancy that you get. So be reassured that it does not have to be like this forever. And if it's something that is really serious, really affecting your life, then come in to see us, see your physical therapist so that we can get there faster.
yeah. I love that. And it's a great positive note to end on, I think.
Yeah.
Well, thank you so much for joining us. Can you tell everyone where to find you and your services?
Yes. So you can find me on social media. I am at Dr. Toya OBGYN on TikTok, Instagram, Facebook, and YouTube. So that's DrToya OBGYN. And then my website is drtoyaobgyn.com/telehealth, TELE health. And so I make it easy. Dr. Toya OBGYN everywhere.
I love it. And
Yeah.
is that a uterus behind you? I'm sorry. I'm looking at
A happy one. Yes.
I love it. I love it. I noticed that earlier and I was going to laugh and I was like, oh, this.
Yes, I keep it consistent. She's breastfeeding. See?
Amazing. Thank you.
Yes.
I love it. Well, thank you for doing what you do. Thank you for joining us
You're
for this
welcome.
very important topic. And maybe if listeners out there have questions, please send them to us. We can always do a part 2.
Yes. And thank you so much for having me. It was a pleasure.
Oh, yes, always my pleasure. And thanks everyone for listening. We will catch you next time.
Okay. Bye.
Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.